Hello, my name is Kenja Hanniford, and I'm the Manager of Continuing Professional Development here at BPS. I'm excited to introduce an update to BPS's existing recertification framework, the Continuing Professional Development CPD pilot program. During this journey, we will go over key components on how to successfully recertify during your 7-year certification cycle. For today's topic discussion, we will go over what is CPD, understanding recertification pathways and requirements, various CPD activities for use towards recertification, resources to learn more. What is continuing professional development? The CPD cycles include several phases beginning with the assessment of learning needs and goals. Then the outcomes-based learning objectives, priorities, and a timeline are generated. Activities, resources, and various learning methodologies are identified and utilized to meet learning objectives. Finally, learning objectives outcomes are impacted and evaluated, leading to a reflection and a continuum begins again. A key to the CPD approach is to connect learning and practice. For BPS recertification purposes, CPD stages will be recorded in your MyBPS profile and reviewed annually for progress. An example of a CPD cycle may be that a board-certified cardiology pharmacist reflects that they need to apply the new guidelines to management of heart failure to their patient population, which aligns with the BCCP content outline. The BCC plans to review the copy of the clinical practice guidelines and learn patient-centric recommendations for clinicians to prevent, diagnose, and manage patients with heart failure by completing a continuing education offering on topics. The BCCP evaluates the new evidence-based approach to manage patients with heart failure against the old guidelines and reflect on approaches to apply the new guidelines. At the end of this recording, resources will be available for you to learn more about what CPD is. My BPS prompts for CPD. To facilitate the CPD process, BPS provides the following prompts for you to document within your MyBPS portal. When reflecting, you'll want to consider your potential needs related to current practice and professional development. Consider the content outline relevant to your specialty certification. What knowledge, behaviors, attributes, or skills did you identify as areas of growth? When planning, you'll want to consider the CPD activity selected to prompt the acquisition of the competency identified for your reflection. Document your SMART goals and learning objectives related to your CPD activity. And lastly, when you evaluate, you'll assess the impact of learning. Describe how the professional development or practice was and will be impacted by this learning. Understanding recertification pathways and requirements. The first cohort of board-certified pharmacists eligible to take advantage of the updated recertification framework, including CPD, are board-certified pharmacists starting a new certification cycle in 2024. This includes pharmacists newly certified in 2023 and board-certified pharmacists who have successfully recertified in 2023. The framework will be applied to each pharmacist starting a new 7-year certification cycle, newly certified and recertified pharmacists, until applicable to all board-certified pharmacists. This table is based on the standard 7-year certification cycle. Certificants who are granted a 1-year extension will be eligible to the updated recertification framework, including CPD, after completing the current recertification requirements during their extension year. BPS's new CPD recertification framework for 2024. Board-certified pharmacists continue to have 2 options to successfully maintain their certification over the 7-year cycle. Option 1. Earn 80 units of assessed CPE via BPS-approved PDP provider, as well as submit 20 units of self-selected, self-reported CPD activities, 100 total units to recertify. Or Option 2. Achieve a passing score on a recertification examination in your 7th year of your cycle, as well as submit 20 units of self-selected, self-reported CPD activities. Whether recertifying by professional development or examination, board-certified pharmacists starting a new certification cycle in 2024 or after must record their personal CPD reflection and plan in their MyBPS profile annually and earn a minimum of 2 units via CPD activities or traditional BPS-approved assessed continuing education during each year of their cycle. BPS Continuing Professional Development. Across several categories, BPS has outlined activities that may be claimed for CPD units towards successful recertification. Activity categories include the following: assess CPE via BPS-approved provider, continuing pharmacy education and CPD portfolios, academic, professional, interprofessional studies, teaching and precepting learners, scholarly activities, workplace activities, and lastly, leadership and professional services. As noted in the first bullet, completing all 100 units required for recertification through a BPS-approved professional development program remains an option. The table on the screen shows an example of 3 CPD activities. this table is not exhausted as several other activities exist. Please view the full list on the BPS website. The diversity learning CPD activities have an annual and cycle maxes, for example. If you're serving as a preceptor for students, residents, or other healthcare professionals, you can earn 1 CPD unit for 10 hours of precepting. You can claim up to 2 units annually for precepting with a cycle max of 10 units. For information about annual and cycle maxes, please review the far right columns on the CPD table of the FAQ page or contact BPS's recertification team. You may be wondering, if you plan to complete all 100 units required for recertification through BPS-approved professional development programs, how do I satisfy my requirements for the 20 units self-reported CPD activities? You will complete 80 units of CPE via BPS-approved professional development programs. For those 20 units, you can choose to complete any combination of assessed CPE via BPS-approved professional development programs or self-selected CPD reported activities. The necessary plan, reflect, and evaluate components for the 20 units must be completed regardless. CPD activities must correlate with the content outline domains of the specialty in which the individual holds BPS certification. BPS will conduct random audits or reported CPD activities to ensure appropriateness is in line with the relevant specialty content outline. BPS acknowledges that this list must not be all inclusive of activities pharmacists participate in to contribute to lifelong learning and professional development. Under this pilot program, BPS reserves the right to update the CPD listed activities. Again, please visit the full list of CPD activities by visiting the CPD FAQ page. BPS continuing professional development resources. Many resources are available to learn more about BPS's recertification and continuing professional development. For certificants who are in the works of recertifying or planning the next steps into maintaining board certification, we highly recommend that you check out the following. If you have any questions regarding recertification, regardless if it's CPD related or not, please feel free to contact us either by phone or submitting a ticket.